Good afternoon, everyone. My name is Dr. B. I'll be conducting today's seminar for dads with HIV-positive spouses. To begin, HIV is a virally transmitted infection that can be transferred through sexual activity or IV drug use. Does anyone have any questions before I get started?
Yeah, I have a question. What kind of symptoms or indications would I expect to have if I was exposed to HIV?
Absolutely. So HIV can kind of go under the rug because a lot of its initial symptoms present as flu-like. You can also have night sweats. You can suffer from abnormal growths in your genital area, and for your wives, they can see changes in their menstrual cycle.
And what kind of tests would a nurse or a provider kind of do on me if I was to do routine screenings?
You can do an STD panel or blood draws as well, just so you know once you are contracted with HIV, it's going to be a chronic ailment. There's no cure for it, so the treatment won't be for curative purposes so much as, management.
Okay, thank you.
Absolutely.
Dr. B, I also have a question.
Randy, go ahead.
What would be some risk factors associated with this disease?
So sexual activity can increase your chances of HIV. That could be anal, vaginal, or oral. Again, like I said earlier, if you're using dirty needles or if you practice IV drug use, that can increase your chances. And if you're in an area prevalent with HIV, that can also raise your chances. Of course, if you're running around with a dirty needle and you get stuck, you got HIV.
I have a question. My wife, we're about to have a baby, and she's HIV positive. We don't have to worry about transferring to the baby.
Actually, yes, you do. So there's a couple ways HIV can transfer to the baby. The first being through the placenta. It'll pass while in utero. The second being through vaginal birth. The secretions can transfer to the baby during the birthing process. And then the last would be her breast milk. If she is HIV positive, it can transfer while she's breastfeeding. The number one way we can avoid that, at least during the birthing process, is a C-section at 38 weeks. And then once your baby is born, we can give her a 6-week treatment cycle of ZDV and the anti-HIV meds. The reason we do that is we hope that the HIV won't form.
So I have a question.
Anyway.
So are there any preventable measures, whether it's non-pharmacological or pharmacological?
So non-pharmacological would be abstinence. That's the number one way to prevent HIV transmission. Pharmacological, we do have a PEP kind of pill. It's like the plan B for HIV. You can get from any ER within 72 hours of exposure. So if you in the event of IV drug use or you're with someone and you believe they may have HIV, you can always go to your ER and they can get you started on that.
Okay. And you said something about treatment, that once a person has it, there's no treatment.
Yeah, it's a chronic disease where we focus on the management of symptoms instead of the cure. Unfortunately, there is no cure for HIV. So once you have it for life.
Okay.
Any other further questions before I move on?
No, sir.
Okay. Some big teaching points we want to go through today is that we want to avoid sexual activity with partners that are HIV positive, as well as avoiding IV drug use. We also want to improve the quality of life for any HIV patients, as well as reducing the stigma. The biggest point I want y'all to take away today is that we want to prevent the transmission of HIV, or the acquisition. Before I wrap it up, does anyone have any last-minute questions?
No, sir.
All right, thank you for your time.
I say cut right when you were done with that.
Human
that last word,
immunodeficiency
that
virus.
acquisition, right when you say acquisition.